Hello there, Dr. Ashley Mack of Ashley Mack Performance and Rehab. Today I'm going to tell you about a lateral shift correction. Now, there's another video that I posted out online talking about the old Chinese woman stretch where you are actually leaning back and pushing your hips forward to add extension into your routine, which could be really helpful when it comes to back pain. But in some cases, if this movement actually doesn't make your symptoms feel better, and maybe in some cases it makes the pain actually shift from one side or the other, you might actually have what is called a lateral shift. If anyone's ever told you that you look a little crooked, someone's ever told you that you have a leg length discrepancy, one thing that you should be able to observe is your relation of your shoulders and your hips. And so if you feel one-sided symptoms, I would suggest that you stand in the mirror, take a look at yourself, look at where your shoulders are in relation to your hips. And in some cases, if you are shifted away, the first thing that we need to do is actually correct that lateral shift. And the way that you correct your lateral shift is the following. We designate the lateral shift based on where your shoulders are in relation to your hips. Now, if that's the case, if your shoulders are this way, it's my shoulders are shifted to the right, to your left, and my hips are shifted left, I have what is called a right lateral shift. Now, left and right doesn't really matter when it comes to just you treating yourself. The biggest focus is that you're trying to correct this shift. So what you're gonna do is if you're, and this is an exaggeration by the way, but if you're noticing that you're slightly crooked, what you're gonna do is you're gonna take your opposite hand of which your shoulders are shifted away from, take your hand, put it on the opposite, or put it on the same side hip. From here, what you're gonna do is you're gonna take your hand and you're gonna push your hips over towards the shift itself, trying to drive your shoulders in the opposite direction, and then you're gonna release. You might feel a little bit of tension in that part of the back when it comes to the stretch. You might feel a little stretch. You might feel maybe a little bit more of an increase in your symptoms or your pain, but as long as, say for example, if you're experiencing one-sided symptoms, as long as the pain migrates from the outside inwards, you're headed in the right direction. And so once you do for pretty much a set of 10, the goal is to reassess and see where you're at. Do you feel better? Do you feel worse? Or do you feel the same? If you look in the mirror and you notice that your shift is corrected, then that's awesome. The goal for the lateral shift correction has been accomplished. From there, you can either continue on with that lateral shift, maybe you get to the point where the symptoms are right in the middle, or you can go ahead and revisit that old Chinese lady stretch, which can really help out when it comes to reinforcing that motion. So again, if you notice that your shoulders are shifted over, try to see if you can correct it by driving the hips in the opposite direction for a set of 10, see if it works, if it helps, see what it's like when it comes to adding that extension in. Now, if the combination of these two movements don't really seem to help you, it's not the end of the world. But what I do encourage you to do is to click on the link below and book a consultation call with me.